to what are our goals, because I think it's very easy when you get yourself set on a project, whatever it is, to kind of move into mission creep. And I think that may be kind of where we're going at this point. But the original goals of this whole project, if you will, 2 months ago was to flatten the curve, to prevent the saturation of the healthcare system, and to avoid a crisis standard of care. The second goal was to stand up the economy no later or as soon as possible. And the third goal was to prevent any dangerous rebound curves. And so we're going to keep coming back to those curves and make those goals and make sure we don't slip away from those goals when we move forward. We showed this slide the last time, and for those of you that have seen it before, I apologize, but there are a couple new people on here, but I think it's important. The difference between a DNA virus and an RNA virus is very important. DNA is the helix, the double helix on your left, and it's very stable. Again, I think of DNA as kind of like an old man who's very stable and does the same thing every day and very predictable. And I think of RNA as a adolescent boy, maybe 15 or 16 years old, that's not very predictable, and you just can't predict where they're going next and what their next move is. Coronavirus is an RNA virus, and that's probably our biggest problem right now. Is it's unpredictable, and we've never seen it before. Again, it's zootic, meaning it came out of animals and then mutated to humans and then mutated from human to human. So our systems have never seen this before. All right, have we seen this before? And the answer is yes. If you look back in the history of the influenza flu of 1918, again, influenza and coronavirus aren't the same virus, but they act very similarly in many ways. And if you just read the newspaper articles from 1918, you could easily take those newspaper articles and you could read them today. Ban on dances, schools are closed, churches are closed, funerals are banned. So we have certainly seen this before. Some of the things that we learned with the Spanish flu, which are directly applicable today, are the fact that masks work. The surgical mask was invented in 1897, just about 20 years before the Spanish flu, and they used it effectively in the normal population and reduced the effect of that flu. They started using social distancing for the first time with the Spanish flu. And if you look at the chart of Philadelphia versus St. Louis, you can see a dramatic difference. Philadelphia had a first case on September 17th, but they didn't really engage in social distancing until October 3rd. Look at the difference in the spike. There was a large parade of soldiers during that time. They kind of ignored advice, and look what happened. About 10,000 people died in that city immediately after that. And then if you look at St. Louis, they started initiating social distancing about 3 or 4 days after their first contact case, and look what happened to that city. So clearly we had a winner and a loser. That being said, the other lesson is that both cities let go of their social distancing and their masking soon after that. And there was a dramatic second wave that affected both cities, in fact, the whole country. So the third lesson was that we may have to maintain this for a while. The issues of vulnerable populations, in this case, directly opposite of what it is today, because the vulnerable population in 1918 were soldiers coming back. They were sick, they were tired, they were malnourished, and that was the vulnerable population, and that's who got hit the hardest. Compounded that with the fact that these are 18 to 25-year-old males who think they're invincible, and we had a big problem back then. The last thing we learned was that tight quarters don't work, such as barracks, and you could transfer that directly today to college campuses, to high schools, to churches, and to large gatherings. And so these are kind of the lessons that we got out of 1918. This is going to become important later on as we talk about what can we do now to open up business. What are the simple things we can do now to open up business right now? Many of you may remember this, the Hong Kong flu of 1969. It's called the forgotten pandemic because there were a lot of other things that were going on in the country and the world at that time. If you think about the history of 1968 and 69, probably paying attention to a pandemic was lower on the list. But we did experience a fairly significant pandemic 1 million deaths worldwide. We currently have about 250,000 worldwide with corona, and 100,000 deaths in the US, which is just about where we are right now. What was similar between 1969 and now? We ran into personal protective issues and we dealt with that. We used masks to effectively reduce the virus. We used distancing to reduce the virus. And there was a lot of political polarization in 69, as there is in 2020. What was the difference? And I'll just throw this out there for thought. The difference was in 1969, this is the year I was born, so I didn't actually experience this, but I did soon after. What did we do as a family? At 6 o'clock, we went downstairs and watched the local news from 6 to 6:30, Channel 6. And then from 6:30 to 7, we watched Walter Cronkite, and that was it. And that was the only news exposure we got. And one of the differences today is we're bombarded with 24/7 news. And it really doesn't matter which channel you listen to. You're getting bombarded with one thought process. And I think that's a problem. I really do, because I think we're in either direction getting brainwashed, one side, left or right, depending on which station you put on. And we didn't have that in 1969. You listen to the news for 30 minutes or an hour at tops. What happened in 1969? It was a very real disease. But we went to work, we kept our businesses open, we went to school, and we got through it. And so I think that we have to take into account how much of effect news is playing on this whole scenario, and we have to be very conscious of that. Here's what's real. We haven't experienced anything like this economically since 1932. That's a real thing. 15% unemployment, that's a very real problem. It's probably going to go a lot higher. I'm sure you know that. I'm sure all of you are feeling that, and as am I. And this is a serious issue that we have to deal with. Never before have we seen this, not in recent times, and that's bread lines in the United States. This is, a traffic jam in Los Angeles last week to get into a bread line. San Antonio up top, food bags being filled in Des Moines. We have 3,000 people a day that are feeding off the food bank here in town out of a population of 8,000. So, real problems are existing. But this is a real problem too. If you look at Beaver Stadium, and I'm sure many of you have been to a game here, or at least watched a game here where the capacity is 106,000. And I'm sure if you've seen a game there, you've felt the onrush of people and the roar of people and the kind of, the energy. That's how many people will have died in this country by next week in the last 2 months. And I think that's a real good visual for everybody to see. What's also a real good visual to see is up in the right-hand corner is the total death curve. And you can see we have not really hit the apex yet. So then you have to assume that there's a downside to that curve. So we can then take that stadium, Beaver Stadium, and we can add in, if you want, Ford Stadium, where the Detroit Lions play. And maybe that's what we're seeing by August 1st. That's a lot of lives. Okay. And those, we hear the politicians talk about numbers, but these are real people. And I think that's the other side of this equation, the other side of the economics. So it really does have to be a balance. I've heard people say it's a tug of war between economics and health, and it's not at all. That's exactly the wrong way we should look at it. We should look at it as a balance. And I think if any one of those two components are out of balance, we're going to have a big problem. One of the themes I'm going to start talking about as we move through these slides today is redefining ourselves as a business community, as a COVID capable community. And I think that's probably the smart way to get out of this. Are our businesses COVID capable? Because I think we're going to be in this for a while. And again, I'll leave you with those three goals. And that is no saturation of the hospital system. Essentially, the country's at that point right now. Outside of New York, we're not saturated. Prevent a dangerous rebound curve. We haven't seen a rebound curve yet. We might, but can we keep it below an acceptable level? And also importantly, to stand up the economy as soon as possible. Ben, I'll turn it back to you there.
Yeah, so you kind of said it well, Mike, with the whole feeling that I have, and again, why I think we put these things together. You know, news comes at us like 24/7, and everyone is kind of glued to that, especially when you're forced to be at home. You know, you're probably more plugged into the news than you were 2 months ago. So from your perspective,
Right.
again, it's unique to me that you're an entrepreneur. You're coming from the medical side of it. Your community is kind of relying on opening up. You're getting a lot of this news too. Maybe share with us, what are some of the things that you're hearing that we could kind of throw into the myth camp? You know, what can we kind of throw out as maybe garbage that just doesn't.
Yeah. Yeah. Myths. I think there's a lot of myths around testing in therapeutics. I think there's a lot of myths around vaccines and when those vaccines are going to be available, if they are at all. And we'll talk about that. I have a couple slides on that. Myths about whether masking works or not and distancing works or not. And then finally, this crazy myth about having to stay inside. So let's go through a couple of those. All right. Let's talk about testing. All of the tests that I'm going to talk about now are what's called an EUA, an emergency use authorization. That means the FDA feels there's a dramatic need to push things through their own vetting process very quickly. We have to be cautious of that. Whenever the FDA does that, that means we're in crisis mode. And that also means there are mistakes. So let's go through, some words that you may not understand. And let me see if I can explain these to you. A PCR test is the current test that we're using right now. That stands for polymerase chain reaction. Basically what that does, if you look at the diagram on the right, this is your standard diagram of a coronavirus. And on the outside of that coronavirus are these proteins in pink, and they look like a crown. That's why it's called a coronavirus. Those proteins are recognizable at some point, but inside, if you would cut the virus in half, you would see an RNA chain, and that's this white kind of single-stranded chain. A polymerase chain reaction test, a PCR test, is done with a nose swab. If any of you have had it, it's very uncomfortable if they do it right. It then takes that RNA and it amplifies it to the point where it turns it back into DNA, and then it amplifies it to the point where it can be quantified. And if you hit a certain quantification level, then you have a positive test. There are problems with this PCR test. Again, it's a test that's been rapidly put through the FDA because we needed it. It's got a fairly significant false negative rate to it, which means that just because that means you could get a test and it could read negative and you truly have coronavirus. That's about 30%. It's highly dependent on technique, and the technique is not comfortable for the patient. And so, if you're not literally jamming that swab up somebody's nose, you're not going to get a good test, and it's going to come back negative, even though they're sick. There are problems with supply chain. There are problems with the timing of how long it takes. Cepheid and Abbott have come out with a rapid test, which is done in about anywhere from 15 to 45 minutes, that we can now use on patients that are going to the operating room, but it's not a perfect test. The antigen test is new. It's first in class. It just came out this past week or so, produced by a company by the name of Cadell. And it tests these pink proteins. Again, it's not perfect. It's got a high false negative rate, actually higher than the PCR test. And finally, the antibody test, which you've heard a lot about in the news, but is actually, of the three, the least useful right now, because all it does is test to see if you've been exposed to this disease. We don't know how many antibodies are going to confer resistance. We don't know that. We don't know what percentage of the population has been exposed, but we think it's very low. It's certainly not enough to return people to work based on that test. And it has a very high false positive rate. which means it could tell you that, yes, you've been exposed to it when you in fact haven't. And so if we turn you back into society, then you're at risk for getting this problem. So there's a lot of talk about testing. The tests aren't very good. That's the bottom line. Let's look at a big fallacy that was kind of put out this week at the White House press conference. And this is just a play on math. And I think that, if we as a society are going to do this intelligently, we have to understand this math and understand the politics behind the math. There's a big difference between tests per capita, the number of tests that we have for the number of people that we have in a country, and tests per positive case. Tests per positive case is actually the most important. We want to be able to test a positive person, somebody who has coronavirus, get that test, and then find out all of the people that they've come into encounter with and test all of those people. That's called tracing, okay? That's what's important. It's not tests per capita. Let me show you what I'm talking about. China has the highest population in the world. It's about 1.6 billion people. They've only had 4,600 deaths. India is next with 1.4 billion people. Billion. They've had about 2,600 deaths. We are third. US is third in in population. We're 330 million at 86,000 deaths. As you know, we've taken a bigger hit than any other country in the world on this. South Korea, way down the list, 27th in population. Taiwan is 55th population. Okay, we should testing more than any other country in the world. And we are. Those numbers are true. What President Trump said the other day is true. We are testing more than anybody else in the world. But we have the third highest population in the world. That doesn't really mean anything. What really means something is how many tests per positive case. And in that regard, the more important regard, we're doing very poorly. South Korea, which has a population of about 50 million, maybe 1/6 of our population, is doing 10 times more positive tests than we are, okay? And their numbers show it. If you look at their death rate, 260 deaths compared to 86,000 deaths. So when you hear a politician saying we're doing an extremely good job with testing, we are not at all. We've got a long way to go with this. I'll get into in a second why this is important, because all of our reopening plans are based on testing, okay? Every single plan out there, 52 plans, all have testing as kind of the primary building block of reopening the economy, and this is what we're doing the worst at. A Harvard study group called the Harvard Global Health Institute tried to extrapolate, well, how many tests do we actually need to be doing per day in order to open up? And they came up with about 500,000 tests per day. That was to test all the people that had COVID with symptoms and their tracings, all the people they came into contact with. 500,000 a day, that's a low number. Another Harvard group said we needed between 2 and 5 million a day. 2 million came from testing 40% of our workforce, and 5 million by testing 100% of our workforce. Romner, who's a Nobel laureate, said we needed 25 million a day to test the entire population before we could return the population to normal. Whichever study you believe, 500,000 to 30 million, today we did 265,000 tests. So we're nowhere near it, okay? And this becomes important when you look at, again, the opening criteria, which we'll go through in a second for Pennsylvania. Pennsylvania is highly dependent on their plan on testing, and this is where we're falling through. Other myths out there, anti-malarials. You heard this in the news about a month ago. This is not working at all. In fact, the risks of using this medication are very serious, and so I think this one is thrown off the list. The antivirals that we have, remdesivir primarily, by Gilead, is coming out. It's looking promising. You're seeing about a 25% faster recovery on patients that get this drug. It's in very limited supply. They're not telling you that in the news, but it is in very limited supply. We just got a form yesterday to fill out that we will get it from the state only if we have a certain number of positive patients in our hospital. So it's a limited resource medication. And these medications, remdesivir and the other antivirals, are in phase 1, phase 2 trials in the FDA. They're very early on in the process. as is the vaccine. And I want to talk to you a little bit about the vaccine. We've heard rumors that the vaccine may be out by within 6 to 9 months. Okay, the fastest vaccine that's ever been developed in human history is mumps, and that's 4 years. Okay, so the concept of getting a vaccine out for an RNA virus that came from animals that we've never seen before in 6 months, that's not real. It's just not. And if it was real, there's going to be a lot of problems with that vaccine, meaning there's a lot of risk to the people that get that vaccine. So I think that's a myth. I think that society should be prepared for a year and a half before a vaccine. If we get a vaccine at all, remember, we never got a vaccine for HIV/AIDS. That never happened, despite billions of dollars of testing. We never came up with an acceptable vaccine. And coronavirus, like HIV, is a very slippery, changeable virus. We may never get one. So I think we have to find ways as a society to open up without relying on kind of false deadlines that, hopeful deadlines that we're not going to get. I guess that's my point there. Another myth out there is masks versus not masks. Flat out, masks work. And if you want to open your business, in the next few months, I think masks are going to have to be part of your plan. If you look at the countries that use masks, look at their rates of disease versus the countries that didn't use masks initially on. So we know that masks work. They're not part of our culture. We don't like wearing them. They're hot, they're uncomfortable, but they work. Let's talk just a second. I want to show you a video about staying indoors versus outdoors. This whole concept of sheltering in, I think, was very much misconstrued in the sense that everybody thought we had to stay inside. And that's about the least healthy thing we can do for ourselves. In many ways, psychologically, certainly, exercise, lack of exercise, family conflicts, but also if you want to promote a disease, live in the same air chamber for 24/7. If you want to not promote a disease, get outside into the fresh air. So I want to show you something that we're putting together in our town, kind of instructional videos on how to do it correctly. And I think if you watch this video and you're a business owner, you're going to start to get some ideas maybe about how you can set up your business. Is your business during the summer months an outdoor business? Is your restaurant an outdoor business? So let's see if we can get onto this. Maybe it'll work, maybe it won't. I turn all this. Okay, so I think that, to summarize those points, this is a recreation-based community, business community. So I think that we're coming up with this library of videos on how to show our tourists how to do things, because basically they're coming into our house, right? That's what's going to happen when we open up business in a few weeks. And we have 3 million tourists that come up into a town of 8,000. And so, we are very conscientious of how we're opening, and are we opening in a smart way, and how are they going to affect our very small hospital system, 17-bed hospital that's 6 hours away from the nearest urban center. So these are the kind of things that the business community and the hospital community are doing together to try and open up these businesses in a safe way. You there, Ben?
Yeah. So maybe let's take that to the next step then. If I'm kind of summarizing the last couple minutes, testing's an issue. Reopening needs to happen. Masks work. You're kind of outlining for us that we're probably going to have to redefine ourselves as kind of COVID ready here. But then let's maybe spin this to hopefully something a little bit more positive, things that we can focus on. If we're all kind of itching for that normal again, even if it's more normal, and we set our expectations, then maybe help us do that. You talked about certain timelines for treatment. Help us reset our expectations.
All right, so that let the next series of slides kind of deals with plans and getting back to a new normal. And what is that going to look like and for how long? This, I don't know if you're familiar with this or not, but this was the original plan that was put out by the American Enterprise Institute. It's called the Blue Paper. It was, consider this plan the grandfather plan because all plans then came from this. The country has 52 plans. We've got 50 state plans, we've got a CDC plan, and a White House plan. And if you think about going into battle, ideally, when you go into battle, you'd love to have one plan, one contingency plan, and then a fallback retreat plan. You don't want 52 plans. And we've got 52. And that creates a lot of miscommunication, a lot of confusion, and a lot of inaction. If you were to summarize the base plan, it would call for a 14-day decline in cases. It would call for no hospital saturation, which we talked about, protection of our vulnerable populations. Who's vulnerable? Elderly. Elderly as a sole entity, elderly in nursing homes, people who are medically compromised, school children and college students because of the barrack type situation, inmates. These are considered vulnerable populations in and of themselves, but also because they're so contained and so vulnerable that they then become a risk to the general population if infection gets into. So if infection gets into a jail, it's actually a problem because then it can spread to the general population. The plan called for therapeutics. We just went through therapeutics. We're really nowhere. We've made no real progress on therapeutics, but the plan calls for it. The plan calls for adequate testing, and we're not really there yet. And then importantly, contact tracing. So if you test positive, who have you talked to in the last couple of weeks, and can we isolate all of those people either at home or in a hotel room? That's what the plans call for. If we're looking at timelines, this is just a rough schematic that I put on a whiteboard, and we can talk about phases of recovery, and this is where the blue plan talked about phases of recovery. So think about January of 2020, we were in phase 0 before any of this happened. That was a kind of a certain level of safety within society. And then the virus hit, and we went down to a very low level of safety, such that we sheltered in place and closed all our businesses down. That's really never happened in recent history before. So the powers that be deemed that that's what we needed to do, and so we did it. And now we're entering this point where we're moving into what's called phase 2, where we're starting to reopen. That's saying that society is a little bit safer and that we can do this. How long are we going to be in phase 2? Well, phase 3 is defined as when the vaccine occurs. And I just told you that, nowhere in history have we developed a vaccine in 6 months. In fact, the shortest time period is about 4 years. Best estimates for this one would be about 1.5 years, given modern science, but there's always the chance that we never get a vaccine for this. And I think everybody has to understand that. Phase 4 would be theoretically a higher level of safety than we've been before, and that's because we've learned from this virus, and also that our biodefenses against bioterrorism have been better. But let's look at phase 2, because that's kind of where we are right now. When we open into phase 2, and some states already have, and Pennsylvania and California have not, but we will soon. We want to keep that safety level in this new normal such that we don't get a rebound curve. Because if we get a rebound curve that goes above any of the triggers that are in the blue plan, we're going back to phase 1. And nobody wants to do that. And so what does that look like? That means that we're probably going to be using social distancing, and we're probably going to be using masks, and we're probably going to be using increased hygiene for the next 1.5 years, if not forever. Okay, that's a scary thing to hear, but at least until we get some kind of vaccine, or at least until we get some kind of therapeutic to take care of this problem, I think we're going to be in this for a long haul. And I think the sooner that people that accept this, the faster we're going to open up business, and the faster we're going to get back to what's considered normal at this point. I want to look at Pennsylvania. So the way the governor has your plan written out, and I've spent some time going through this for you. Some plans across the country are divided into counties. The Pennsylvania plan looks at regions. And so Berks County falls into unfortunately, probably one of the highest concentration regions in your state, because you're thrown in with Bucks County. You know, even though Berks County is considered a rural county, you're thrown in with Bucks County, Chester County, Delaware, Lancaster, and importantly, Montgomery, Philadelphia, and Schuylkill counties. And that's probably going to pull you down. I really think it is, because you're thrown in with these more urban areas that, by definition, have a higher concentration of disease. But that's the way the plan is written. Um, the way the plan is written for opening is, no more than 50 new cases per 100,000 population in 14 days. No hospital bed saturation, which you don't have at this point. Adequate PPE for workers, which you do have at this point. And the ability to test, trace, and isolate, which you're, from the best I can tell on the research I've done, you're almost there, if not there, on that one. You've got the manpower to test people and to trace them down and to isolate them, at least in their homes. Homes is not ideal because then we infect other people in the house, but hotels would be ideal. That's probably not going to happen. But in terms of actual numbers, if you do the math on that calculation, your opening trigger number is 15 cases or less per day. And as of yesterday, you were at 32. So you're not there yet based on that plan. Now, there's going to be a lot of political pressure, as you know, because some states are opening up and have already opened, and because there was a case today in Wisconsin where the governor extended the plan and the state justice rejected that statement. So I think there's going to be, for better or for worse, and again, I can look at it both ways. There's going to be a lot of political pressure to kind of either change the plan or to slip on the plan. Let's put it that way. All right. What happens if we open up early? Let's look at some numbers on the left. The week of April 13th through 17th across the country, 62% of the people were staying home. Last week, 44% of the people were staying home. This past week, 36% of the people were staying home. So the dam is starting to break, so to speak, across the country. And I think that's going to just continue to increase. If you entered the curve early, such as, let's say, Georgia, then the curve is going to, without question, rebound, I think, severely. Maybe I'm wrong. Hopefully I'm wrong, but that's not what I'm reading. If you enter the curve way late, this green arrow, let's say a state enters in mid-June to July, that's late. You would effectively negate the disease, but you would kill the economy completely. So that's not a good answer either. If you would enter at what's considered a sweet spot, and that sweet spot based on the blue plan is somewhere around May 15th to June 1st across the country. We are going to get rebound curves. There's no question about it, but those rebound curves will be below the saturation point of the hospitals, which was the original goal. The original goal was never to eradicate the disease. It was to keep people safe within the hospital systems. If you jump in a little bit early, which is, let's say, today, we don't know. We're going to get rebound curves, and we don't know where that rebound curve comes with regards to the saturation point of the hospitals. And there's the risk that if we saturate the hospitals, we're going back into phase one, which nobody wants to do. Okay. So this is really a trial and error period with 52 plans. And that's not a great way to go. If you look at models that have been put out there, one of three models are going to occur. We're going to see a wave here, and then a second wave, a third wave, a fourth wave, and a fifth wave. Again, the goal is to keep these all below the saturation point. This second model was based off the Spanish flu, and that if you look at the graph for the Spanish flu, that's exactly what happened. Is the country reopened, and then we had a big, massive respike, and it went over the saturation point. We don't want that. Kind of what we want is something like this, where we get this slow burn, always under the curve, and we're kind of hoping for something like this. Let's look at some countries that have done things well from a health standpoint and from an economic standpoint. And if you look at some of the Asian countries, they're actually doing pretty well with this. Why are they doing well with it? Well, first of all, they have experience in it, which we don't. They had SARS back in 2003, and they learned some good lessons. Second of all, they initiated masks and distancing very, very early. It's kind of like St. Louis versus Philadelphia. And third of all, they're culturally different. You know, they have one plan, and if you don't follow the plan, you get thrown in jail. They don't have 52 plans. So our cultures are different, and we have to respect that. The interesting thing is the irony of immigration with all of this. All three of these countries did extremely well, and then they opened up their borders, and they did see a secondary spike. But importantly, that secondary spike was below their saturation point. Importantly, they were able to keep their economy open, and the rebound curve was manageable. What's interesting about all five of these countries is when they saw the rebound spike, it was due to immigration. And by immigration, I don't mean people coming here and living here. I mean people traveling into their country. Um, What's interesting about this right now is the US is getting hit harder than any other country. And right now, from a travel standpoint, we are probably becoming the pariahs. We might be at a point where the first time in history, we're not allowed to travel to other countries because they're doing really well and we're not. Okay. And so that's going to be kind of interesting to watch. Um, this just came out of the New England Journal of Medicine, New South Wales in Australia, and they did a really good job. And you could take this, the lessons that they learned and how they applied them, and you could take this to the business community in Kutztown and actually do fairly well. One, they had a unified plan. Just because we have 52 plans in the country doesn't mean Kutztown can't have its own plan. Okay, there's no rule that says you can't do that, and that's what we're trying to do here in our town, is really come up with our own plan, and say to people that come into our town, you're now in our house, and these are our rules, and this is how we play. If you want us to be open, and we want to be open, and we want to serve you, but these are the rules going forward. You can do that, and it doesn't take much with your city government to do that. They did have border control. It's hard to control borders in the U.S. But they did, and that was part of their success. They were very aggressive with their testing, tracing, and isolation. And again, can a small community like Kutztown do this? I think they can. This is what we're really driving here in Mammoth, is if you get a positive test, everybody you came into contact with is tested and then put into isolation, period. They had a very high compliance with their mask and distancing. And this is, our county public official made this a rule here a month ago or more. And there's a lot of social pressure in town if you don't have a mask. I mean, a lot. And so it's just become our norm here to wear a mask because we are at risk. Every business in town in Australia and here now, there's a business plan, a business health plan, and we took the hospital and the business leaders in town and sat them down probably about a month and a half ago and said, how can we reopen in a smart way? And everybody came to agreement. It didn't happen overnight. It wasn't a nice meeting, let's put it that way. But I think at the end of the meeting, everybody came to agreement. And that is, if you're going to open a business, here's how you do it in a safe way. And I got to say that, we've opened up a few essential businesses in the last week here, and I've been in them, and they're doing a phenomenal job. And I feel safe, very safe being in there. And I think other people do too. And I think it's going to become a business advantage to these small businesses to have these, safety measures in place, because people are going to go there preferentially. And so with regards to restaurants and the sports shops in town, the tourist-based shops in town, they're really doing a good job, but it took some planning. It didn't happen overnight, and it took some agreement and some compromise. In New South Wales, they did this, and they went from 212 cases a day down to less than 1 case a day. And so they're very successful. Importantly, they didn't shut down their economy. They never saturated their hospital system, and there at this point has not been a rebound curve. So they satisfied the original goals by kind of adapting to this as a community. Okay. Leave it up to you there, Ben.
Yes. So Again, really appreciate perspective here, Mike. Again, you're kind of defining a new normal for us, and it's a harsh reality. I guess my kind of follow up question to you on behalf of a lot of people I know on the call here, um, what then can we focus on as individuals if we really are at the mercy of kind of understanding that timelines for vaccines, even the whole idea of a cocktail of drugs for treatment, are not something that we really can bank on. But again, the economy needs to get going.
Yeah.
Maybe spin this around for us a little bit.
Yeah.
I mean, I heard you
Yeah.
give the best commencement speeches ever, close to a year ago. With all your experience and knowledge, what advice, encouragement can you give that kind of allows us to live in this new normal without it sounding so harsh?
Yeah. So, for better or for worse, in my life, I've been involved in a number of mass casualty incidents, and these are some nasty environments where bad things have happened and continued to happen. And I think one of the most important lessons that I've walked away from these, whether it's 9/11 or earthquakes in Asia or wherever it is, um, you can only control what you can control. Okay, and if there are things that are outside your control and you focus on them and stress about them, you're leading yourself down a very unproductive road. And so we can control what we can control, and that should be, I think, the theme for the community of Kutztown and for the business community of Kutztown and for the educational community of Kutztown working together. Let's focus on what we can control. We can't control that we've got 52 plants. We can't control that testing in the United States is the worst in the world. That's honestly not our concern right now. We can control that there's a common enemy. We can control that there's a common fear and that there's a common goal. And if you put those three things together throughout all of history, that really motivates people. You can control that Kutztown is an extremely tight-knit community that you may not think so because you live there, but I can tell you from the outside, you work extremely well together compared to other communities that I've lived in. This one here works well together, but I've lived in other towns where it just doesn't work together. You do. And that's a competitive advantage at this point. I would accept the fact that we're down right now. And sometimes when we accept the fact that we're down, that motivates us to get up. And I think that's really important. And stop painting a rosy picture. I'm not just saying that to you, I'm saying that to the entire country. Stop painting the rosy picture because it's not rosy. And once we accept that, then we can get better. And I would accept the fact, as much as people don't want to hear this, in many ways, we are no better than we were in 1918 because the only defenses we have right now are putting on a mask and distancing ourselves. The medications, they're not great. The tests aren't great. And the vaccine isn't here. So in many ways, we haven't progressed much in 100 years. Accept it. All right. So then what can we do? I think you can put your business community together right now if you haven't done so already. And, have a series of meetings and say, how are we going to move forward? In fact, how are we going to become the best community in our local area from a business standpoint? What does best mean? Best means the safest. Best means, you create a business that you feel safe being in. You create a restaurant that you feel safe taking your mother to. You create a workplace that you feel safe sending your wife or husband to for 8 hours a day. And if you focus on that, create a school system that's incredibly safe that you feel safe sending your kids to. If you start to focus on that, the things that you can control, you're going to be successful. If you focus on blaming and throwing your hands down and saying we're not doing a great job as a country, we're not going anywhere. And I think, all small towns in this country need to start doing that, taking the ball into their own hands and just saying, this is how we're moving forward, because there's no real clear plan from above. Anyway, that's my thought. This is kind of the direction we've taken here. And it seems to be working. I think we're ready to open here. We've put a lot of work into it in the last month or month and a half. I think we understand that we have 3 million tourists coming our way very soon, and that's going to bring some disease and it's going to bring some sickness, but I think we're ready for it. But I think we also, disease and sickness comes in the form of economics too. And we have to take care of that part of our health system as well.
So then I think I'd kind of throw one more at you here, Mike, and it's been about an hour. And again, on behalf of everybody, really just not only was this incredibly useful, but we just have to be very grateful that you were willing to give us this time. And I'm sure we'll find other ways to follow up and stay plugged in together, coast to coast. So again, thank you for that. You know, if I could kind of then wrap it up with one last kind of question. Again, this new normal, to a lot of the people I'm looking at on the screen here, you know, what is it? Maybe simplify it for us. What is it that can make them feel safe being out in public again without a vaccine, without treatments?
Yeah. Can you go to the grocery store and feel safe? Yes, but you're going to be wearing a mask and you're going to separate yourself in the store and you're probably going to clean your groceries before you come in the door. You may think about changing your clothes before you come in the door if you've been in a high exposure area. Can you go to work? Yes, you can go to work and you should go to work, but you should do it in a safe way. That means that, you know, if you're a small business owner, do a temperature check and a screening of symptoms on every employee before they start the workday every day. Is that a proven way to decrease the disease? Yes, but more importantly, it makes your employees feel comfortable. It makes their spouses feel comfortable. It makes their kids feel comfortable, which means they're going to continue to go to work. And that's what's important. More importantly, if your customers see you doing that, they're going to feel comfortable in your store. Put X's on the floor every 6 feet in your stores. And that's where people stand in line. And you do that for 2 weeks. We did this a month and a half ago. You know, everybody kind of gets it. Make it socially cool to wear a mask. Okay. It's okay. I mean, it's not a big deal actually. Once you get, I've lived in a mask for 25 years as a surgeon. It's, you know, it's not that big of a deal for me, but we can do it. Figure out a way to get your kids back to school. And I don't have an answer for that yet. I have 3 kids, as you saw, and I don't have an answer for that yet, but we're working on it. And so I think that, you know, once we start accepting these things and just working together, and again, the beauty of Kutztown is the same as the beauty of Mammoth Lakes is it's a small town. I mean, it's not like you've got 200,000 people that have to come to agreement. You've got 5,000, 10,000 people tops that have to agree on something. That's actually pretty easy to do if you put your mind to it. And so I think that once you get to that new normal, that's when things are going to start clicking again.
Okay, so I have 3 takeaways here. Then and I'll kind of recite them, and you can edit my listening skills here, Mike.
Sure.
So number 1, I think as a community and even just as you know, humans here, we need to kind of redefine ourselves as COVID capable.
Yeah.
You know, I think we'll ask for that link and maybe we can push that back out, sharing your video series as a community that really came together with a plan, that's doing it together. I like the analogy of you're coming into our home. So like all good parents, right? We're going to set some expectations. We're going to set some ground rules, but inviting others back in with a safe environment, kind of coming together with a community plan. That's my takeaway number 1.
Yeah.
Number 2, masks work. I heard you say it on numerous occasions. So I have great faith in the medical world and scientists. You know, we all need to be optimistic that something will work out. But in the meantime, masks work, distancing works, hygiene works. I guess the third thing that my takeaway from today is, you know, again, you've defined a new normal. It's not rosy. Data does not seem to be very accurate based on what you're sharing. And I think some of us probably kind of got to that point already with all the different reports that come out. 52 plans isn't ideal, but again, we can do it together if we kind of stick to kind of the rules of the game here. So
Yeah.
those are my 3 takeaways.
Yeah. Let me throw one more thing at you. And I think that the 2 towns, Mammoth Lakes and Kutztown are very, you'd be surprised how similar they are. And I know that, you know, Matt and Shelby Brett were out here this summer and they commented on that as well. But we have a tourist population from Los Angeles and San Diego, 6 hours away, that, we're their playground. You have a college population that's going to be influxing in at some point, and they are your tourists, so to speak. And so you're going to have to accept your tourists, because as you have town and gown issues, we have town and tourist issues, because they're not part of our house, and they don't necessarily follow our rules or respect our space. You have the same issues. And we have really tried to think out how we're going to accept these people in a welcoming way, but in an educated way. And I think that one part of your plan should be, how are you going to accept the college students back and educate 18 to 20-year-olds who are invincible in their eyes, to play by your rules so that you're safe. And that's going to be a big part of your plan, I think. And there's absolutely a way to do it. Absolutely a way to do it. But I think you need to think about that.
Again, appreciate the time here, Mike. I think, now's probably a good time to wrap it up. Again, appreciate you giving an hour of your time here. I'll note again, you're going to be generous again on Sunday night with Dr. Howard. So anyone that's kind of interested in jumping back on that one, we'll find a way to get that link out. That's going to be Sunday night at 7 p.m. Again, you're all welcome to join that discussion. And again, we'll kind of provide that link. I think it'd be really great to see those videos that your community's putting out to kind of help educate.
I'll get my kids on it. I'm not the guy to link them up. They can.
We appreciate it. So I guess I'll, again, thank you for the time here, Mike. We really appreciate it. To everyone on the call, thank you for your time and kind of joining us. Stay safe, stay sane. Again, thanks, Mike.
Great. You bet. Thanks, everybody.